Can testosterone replacement therapy lower the amount of inflammation in your body? Or does testosterone as a molecule in general lower the amount of inflammation in the body? We're going to speak to a TRT expert after this, so keep watching. Hi, I'm Mike, the founder of Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, consider subscribing and leaving comments so we can answer them in future videos. And do be sure to watch until the end of the video, where we'll be discussing certain comments and questions from past videos. So today we're here with Dr. George Triatos, a TRT expert, former bodybuilder, author, and a good friend, and we'll be discussing, does testosterone have a role in inflammation in the body? So we know that inflammatory diseases aren't very good for your health and well-being. So hi, Dr. George, let's talk about that. So you want to talk about this topic. It's many of the diseases, I think, as you know, may stem from out of control inflammation, either due to autoimmune.
Well, basically, low testosterone and hypogonadism equal inflammation. Why? Because if you lack of testosterone, you become obese. If you become obese, you have insulinemia. Insulin is an inflammatory hormone that leads to obesity, metabolic syndrome, and diabetes type 2. So testosterone can reverse this condition, and this is explained by the fact androgens oxidize the visceral fat that is linked to insulin resistance and dyslipidemia, and also the fact that testosterone builds muscle, and muscles oxidize and burn the glucose. Therefore, they fight glycemia. That means insulin resistance. So by lowering metabolic syndrome, obesity, and diabetics type 2, we can conclude that the main androgen is anti-inflammatory. And another fact is that androgens and testosterone in particular, and of course anabolic steroids, are reversely related to the inflammatory catabolic hormone cortisol. Okay, so you can handle stress more if you're eugonadal. If you're hypogonadal, then cortisol dominates, and DHEA is also out of control. So you cannot handle stressful conditions according to your talk. So testosterone, for these two reasons, we can conclude that it's anti-inflammatory hormone.
So there's a study, it's in the Aging Male from 2019, and the article posits the relationship between circulating testosterone and inflammatory cytokines in men. And I think one of the main points it had, as you mentioned, is that there is a link between men with low testosterone and these inflammatory markers.
Yes, absolutely. In COVID, in ICU, when all men, and most of them over 70 are likely to be hypogonadal, they have a cascade of inflammatory cytokines, interleukin-6, a tumor-necrosis factor, coming out of their belly fat because of the low testosterone. And those men are of higher mortality and less survival rates. We understood the importance and the significance of testosterone. Not that testosterone can reverse COVID, but having a good testosterone level and absolute no visceral fat, then you are more likely to survive to the cascade of the inflammatory cytokines that take place in the COVID.
How bad are these cytokines? I mean, how many people do you think are living with high levels of cytokines and inflammatory markers?
You know, I went to the supermarket half an hour ago, and I was watching in a pathetic view all the out-of-shape people wearing masks. How long are we going to bear wearing the masks? Get the vaccine, but mostly get in good shape. Okay, those people are toxic, overweight individuals, you know, and they have visceral fat, and they have unbalanced hormones that just in case they get COVID, they're going to be screwed, literally. You know, I never got COVID so far, but I'm not afraid. I got my vaccines. But apart from this, I'm taking this plethora of hormones and also of supplements that ensure me good immunity levels, all right? So during the COVID pandemic, this is really critical, okay? Being in shape and having a good physical level that reflects to interleukin-6 and tumor-necrosis factor, okay? That perhaps they can correlate with the C-reactive protein.
So are there other markers besides, well, just for everyone, the C-reactive protein measures what? The level of inflammation. What other things should we know about C-reactive protein?
Yes, any kind of inflammation, even septic or non-septic, okay? It could be viral, could be inflammation, for instance, in the joints, whatever that is, okay? But it's more accurate and more sensitive than the erythrocyte intimidation rate. That is affected also by other parameters. So CRP and actually the high sensitivity can predict in case you have an inflammatory disease in your endothelium, for instance, in your arteries, okay? A vasculopathy and a cardiovascular disease.
What other markers are there for inflammation?
We have ferritin also that elevates, platelets also elevates, and fibrinogen also that elevate. And erythrocyte sedimentation rate, as I said, and C-reactive protein. Those five things that I just pointed out, they elevate. But the number one is CRP and ESR, okay? White blood cells also, I'm sorry, white blood cells is something classic, okay?
Well, I mean, according to this article, maybe we should also be looking at testosterone levels. And if you're hypogonadal, this may be a risk factor for inflammation, or maybe you put this in the category of the lower your levels of testosterone, the more at risk of inflammation.
And also the skinny fat body type is also very vulnerable to inflammation.
Tell everyone what the skinny fat body type is.
Because the skinny fat means low basal metabolic rate due to low skeletal muscle tissue. And skeletal muscle and adipose tissue are reverse related. It doesn't mean that one tissue is transformed to the other, but the less muscle you have, the more fat you gain, okay? And if you are under muscle, you are over fat.
Okay, so if you're under muscle, you got more fat. So yeah, that would make sense. And if you
So you don't have to be a BMI of 30 or 40 in order to be obese. You can be skinny fat, and this could have visceral fat, you know, the belly fat, that releases the inflammatory cytokines.
So what's then a good strategy? I mean, for a young person starting out.
Nutrition plays a fundamental role, okay, apart from replacement therapy. It has to be absolute zero sugars that trigger insulin spike. It has to be with anti-inflammatory fats, omega-3, okay? Minimize omega-6 because the ratio now is omega-6 to omega-3, 6 to 1, something like this, instead of 3 to 1 of omega-3 versus omega-6. Plenty of antioxidants coming from vegetables. And if you want to eat protein, focus on the white meat and fish and accompany this with vegetables in order to adjust the acidic environment of the high protein, okay? So even the keto diet, if it's based on olive oil and plenty of vegetables and fish instead of bacon, salami, sausages, and steak, it can be less acidic and lowering the insulin through the low carbs, okay? This is something very basic to lower the inflammation.
One of the strategies that I think is a good approach that I've taken in my life has been, in my 20s, I wanted to maintain the most muscle mass as possible, so that in my 30s maintain it, because as we get older, and I've read a study about the importance of maintaining muscle mass as we get older, and obviously testosterone helps you with that. So I guess I'm saying is if you have a combination of increased muscle mass, optimal testosterone levels, you really should be reducing the inflammation then in your body at that point. Or is there something else that needs to happen?
Proper diet, of course.
Diet, okay. And besides diet?
The diet I just described, Mediterranean diet, yes, in low in carbs. No keto diet, but low carb diet. Starchy carbs, vegetables, okay, and skip totally the sugars and the hyperglycemic carbs and the refined carbs, of course. I think also avoid alcohol, tobacco, UV radiation excessive. Sleep is fundamental also for anti-aging 11 to 7 to kick G8s. And
getting enough sleep. How many hours do you recommend?
8, 1/3 of the day and before midnight. This is the ideal, 11 to 7.
Yeah, absolutely. So I guess just living a balanced life, obviously getting enough sleep, having optimal levels of testosterone, either through diet and exercise. And if you...
That's all, man. I mean, people who exercise, they look healthier and they look also younger. It's not just about the body, but also this reflects on the face. And it's really pathetic, Michael, looking the endos that they don't want to help with this and they prefer hypogonadic men, because testosterone is not about sex and lifting weights. It's also against the metabolic diseases, not just depression, not just erectile dysfunction, and muscle wasting by diabetics, obesity, and metabolic syndrome. That mainly lead also to cardiovascular disease, okay?
You're right, and it's a bit sad really that the endos don't care, but then maybe this isn't their area of specialty. And maybe they should just stay in their lane, because they are probably causing more harm than good by trying to dabble in the areas of testosterone treatment when there are, professional clinics and doctors like yourself that focus on this area, that looks at holistically all the benefits of TRT on one's health and wellness.
Well, they deal with adrenals, they deal with thyroid, and they deal with pancreas. That's all. Yes, a very classic excuse is stay the way you are. You're just aging. But aging is a disease, damn it.
Yeah, exactly. So, and that's something that we're trying to change that paradigm, and I don't think it's going to happen overnight. But we're doing what we can, balance my hormones with with your contributions to making people aware on this channel, to making people aware of this. So, if anyone has an experience with an endo, or a bad experience with one of their doctors, let us know in the comments below. We'd like to hear that. And now, why don't we answer a question from one of our viewers, as we promised. And it was actually a really good one, George. So this one has to do, and it's something we touched on before. It was someone named Jackson. He posted this a day ago, and he said, amazing video, truly informational. That was our last video. We talked about endocrine disruptors and pesticides. So I'll put the link either above or below in the comments. And he said he had something called a testicular varicocele. Okay, he believes over 20% of males have it. There's a small chance that it may cause low testosterone, he's heard. And he said, can you please give me some advice? It'll mean a lot, since you guys are very knowledgeable. Well, I mean, I guess what he's saying, is it more gradual when you have a varicocele, that all of a sudden, I think it's also with TRT, all of a sudden you notice your levels are lower than they were in the past, because you're starting to get symptoms which creep up on you. So, I mean, I had a small varicocele. I think that contributed to my own low levels of testosterone and symptoms that matched. And so for this young guy, I think he's a younger guy, his name's Jackson, he might be suffering from low T, and the varicocele may be the cause of it. So
But I have no idea, speaking theoretically, but I don't think the main issue with varicocele is the low testosterone, but the low fertility. This is what concerns me more.
If he wants to maintain fertility.
Well, he certainly needs HCG in case he starts testosterone, out of the question.
Well, that's good to know. I think appreciate it. And again, if anyone else has other comments, we either make videos on their own or we add them to the end of our videos. So thanks for watching until the end. We can just summarize the video now is the inflammation in testosterone. Testosterone helps lower inflammation, and it can contribute to a healthy lifestyle.
Now, there was another, I'm sorry that I'm interrupting you, that what came into my mind and speaking about this topic was Ron McLean, our friend in the US. He said that the contribution of testosterone to lower inflammation is in the joints. But yes, he speaks about the musculoskeletal system, but testosterone is something different than that. It's in the metabolic issues, and this is more important than just the joints. Of course, it lubricates the joints, and through the aldosterone, through the estrogens. But it's really so cool knowing that testosterone can lower your C-reactive protein out of insulin resistance, obesity, metabolic syndrome, So it's a wonder drug.
Absolutely. So I think we'll leave it on that. If you liked the video, please consider subscribing, and you might want to also get notifications. That will help, because we are dropping videos at least weekly, sometimes 3 times a week, depending. But sometimes they binge, sometimes they don't. But thanks, Dr. George, for coming on another Balance My Hormones show. We'll see you soon. The best place to contact us would be at balancemyhormones.co.uk. That's balancemyhormones.co.uk, and there's an online form you can complete registering your interest. You can also find information and some of the videos that we posted on YouTube on our website as well. There are little icons at the top with all our social media links, and there is a separate social page where you can go to look at the latest content that we've shown, as well as our YouTube channel, Balance My Hormones TRT in the UK and EU.